All right, gentlemen, and let's be honest, probably a few curious ladies. Today we're diving into one of the most whispered about, over-Googled and anxiety-inducing topics out there, penis size. Yeah, we're going there. And before you click away thinking, oh, not another one of these conversations, stick around. Because today we're separating myth from fact, science from locker room gossip, and throwing in some light-hearted truth bombs along the way. So, let me just rip off the band-aid. Can you actually make your penis bigger? And if so, how? And here's the million-dollar question, does it even matter? But here's the science-backed truth. The average erect penis length is about 5 to 5.5 inches. Yep, that's the global average. So if you've been thinking everyone else is walking around with mythical measurements, breathe easy, my friend. You're probably right in the middle of the bell curve. Now let's answer the real question. Can you actually make it bigger? Well, yes and no. And before you run off looking for magic beans or enchanted creams, let me break it down. First up, penis exercises. You've probably heard of jelqing. It's this manual stretching exercise that's supposed to increase length and girth. The science? Womp womp. There's no real evidence it works. At best, you might notice temporary swelling. At worst, overdoing it could lead to injury, scarring, or ironically, less sensitivity. So, yeah, proceed with caution. Next, penis pumps. Now, penis pumps actually do work, kind of. They create a vacuum that pulls blood into the penis, making it look temporarily larger. Temporarily. You're not going to permanently add inches with one of these bad boys, but if you've got erectile dysfunction, they can be a helpful tool. Just, read the instructions. Devices and extenders. Medical-grade penis extenders have been shown, after months of consistent use, to create slight increases in length. Think millimeters, not magic wands. But hey, science backs it. The downside, they require a lot of time, patience and proper technique. This isn't a set-it-and-forget-it situation, folks. Surgery, the final frontier. Penis enlargement surgery is a thing. But let me tell you, it's not as glamorous as it sounds. One common procedure involves cutting the ligament that holds your penis closer to your body, essentially making it hang lower. But, and this is important, it doesn't actually make it bigger when erect. Other surgeries involve fat injections for girth, but these can lead to lumps, uneven results, or reabsorption over time. If surgery is on your mind, talk to a real urologist, not someone offering discounts on Instagram. Now let me drop a truth bomb. The best enlargement technique isn't found in pills, pumps or scalpels. It's in your overall health. Weight loss and fitness. Yep, I said it. Losing belly fat can actually make your penis appear larger because there's less padding at the base. Exercise improves blood flow, which, spoiler alert, means better erections. And while we're at it, stop smoking. Smoking messes with your circulation, and trust me, your future self will thank you. Confidence is the real MVP. Here's the deal. Most women don't care nearly as much about size as men think they do. Studies consistently show that what women value most is emotional connection, trust, communication, and effort. And no, that's not just some fluffy self-help nonsense, that's cold, hard science. Look, you can have the ideal size according to every internet forum, but if you're insecure, disconnected, and rushing through intimacy like it's a competitive sport, well, my friend, you're still going to strike out. Now let's address the elephant in the room. Will she leave me if I'm not big enough? If someone leaves you because of size, here's the harsh truth. They were probably going to leave anyway. A strong relationship isn't built on measurements. It's built on communication, trust, and being present with your partner. But let me also acknowledge this. Insecurities are real. If this is something that's genuinely affecting your confidence, your intimacy, or your mental health, there's no shame in talking to a professional. A urologist, therapist, or counselor can offer support without judgment. And let me say this loud and clear. Women aren't walking around with rulers in their purses. The vast majority care about how you treat them, how you make them feel, and whether or not you're fully present when you're together. So, what's the takeaway from all this? Size isn't the secret ingredient to sexual satisfaction. Connection is, communication is, confidence is. Treat intimacy as a shared experience, not as some kind of performance test. Focus on her, focus on trust. And remember, the brain is the most powerful sex organ, not what's below the belt. All right, my friends, let's wrap this up with a little disclaimer. This podcast is for informational and educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. If you're struggling with insecurities, intimacy issues, or considering any medical interventions, talk to a qualified healthcare professional. There's no shame in asking for help. It's one of the bravest things you can do. Remember this, you are enough. Right now, just as you are. Be kind to yourself. Take care of your health, mentally and physically. And remember, confidence is always the sexiest thing in the room. Until next time, stay confident, stay kind, and keep showing up. You've got this.